Okay, as promised, I'm posted a graded assignment, which will also help you with the practice. I'm sorry, which I'm also calling a practice quiz, and this will help you get ready for quiz one, which I'll release on Thursday. So let me show you what's in the practice quiz slash graded assignment, which you can open and close as many times as you want. So essentially what it is it's a series of true and false questions related to the week one discussion around the U.S. healthcare costs crisis. So I think these questions are pretty self-explanatory, and I just want you to go through and answer them. And then after you answer those questions, I've posted some short answer questions. So what I'm going to do is on Thursday or Friday, what I will do is I'll post my solutions to these short answers. Okay, so I'd like you to do this practice quiz slash graded assignment before Friday at noontime, and then I will post the answers. And so that should give you all the information you'll need for understanding what's being asked in this graded assignment slash practice quiz. So as I mentioned before, for quiz one, make sure you focus on what I put in the week one and week two folders. So just getting back to the graded assignment. So the first short answer question I ask is identify at least 5 core cost drivers that are thought to be behind the steady increase in U.S. healthcare cost. So you'll find that in the week one folder. I put together a series of short presentations, 10, 15-minute presentations. One of them focuses on cost drivers in the U.S. healthcare cost system. And the next short question is the major roles and responsibility of the management accountant. So that you'll find in the lecture slides related to an overview of managerial accounting. And also you'll find the answer to this next question: what's the difference between cost commitment and cost occurrence, in that overview, in those overview slides as well. And then what are the 4 components of the code of ethics for the management accountant? So you could find that online under the Institute of Management Accountants, or you can also find that in the lecture slides that I put out in the week one folder under the overview section. Okay, so then the next couple of questions, I just put a short sentence or two out here, and then ask you to comment on it. So the first is about costs in healthcare and this issue of direct costs versus indirect costs. So I ask you to think about how should we assign indirect costs, because one of the problems we have when we talk about cost assignment is how do we figure out the cost of something? So one of the big issues is that we have a pretty good handle assigning direct costs to a cost object. So for example, in this particular case, heart surgery. So the direct cost would be the cost of the physician, the cost of the other people that are in the room assisting the physician, any materials that the physician may use in the process. But the indirect costs, which are all the other costs and are significant, sometimes estimated to be between 60 to 80% of the total cost, include things like the cost of the facilities, the cost of the room, the cost of the IT infrastructure and the support staff and so forth and so on. That becomes a more problematic issue in terms of how do we assign that to the cost of something we do. And it's important that we figure out the cost of something that we do, because in theory, what it costs us should be reflected in the price to the patient or to the health insurance provider. So one of the big challenges that we face in the managerial accounting world is, what do we do with all of these indirect costs, which are an increasing amount of the total cost in most healthcare settings? So I ask you to comment on that. And then the next short question is about the fact that most healthcare operations are now finding it increasingly difficult to increase their revenue side. So to increase or maintain profitability, or to get to profitability, they have to focus on the cost management side. So I ask you to think about how healthcare operations might go about doing that. And then there's an article that I posted about how not to cut costs in healthcare. So I'd like you to read that and comment on it. And then the last short question is about lean in healthcare. And so there's a couple of postings on that I'd like you to look at, and then write your response here. Okay, so view this as practice. You go back and forth between what's posted in the week 1 and week 2 folders and answer these questions. And of course, I will be available if I can be of assistance to you in answering the questions. Beyond that, you should feel free to email me, call me, and then I will post what I see as the best answers to these questions sometime later on Thursday. Okay, so look forward to seeing your responses to these questions, and I will talk to you soon.